Hello and good afternoon. I'm Dr. Brooks Jackson, Dean of the Carver College of Medicine and Vice President for Medical Affairs for the University of Iowa at University of Iowa Hospitals and Clinics. And I wanted to take a moment to address many of the concerns that I've heard of faculty, staff, and students coming back to campus in the last couple of weeks and addressing the concerns you may have about the safety of in-person classes, of working in the laboratories with various students and others. How safe is it to get health care at UIHC? And from my experience, and I'm a physician scientist, a virologist in particular, with a lot of experience in the prevention and treatment of viral diseases. For the past 6 months, we have worked really relentlessly every day, 7 days a week here, to make sure that we can provide a safe learning environment, treatment environment for our staff, faculty, and students. UIHC is basically a small city of almost 17,000 people. What we do is very essential. We deal with sick patients all the time, COVID patients as well. And so we have put together a very good program of personal protective equipment using face coverings of face shields or face masks, hand sanitizer, social distancing. These are things and methods that I think have been very effective. And if they're followed, I think will protect you and others. I will say I personally see patients still. I work in the lab with specimens from COVID patients. This past several months, I've been working with students, both medical students and undergraduate students from College of Liberal Arts and Sciences, in person, in the lab, with lectures, in person. And we all wear our PPE, our face masks, face shields, or both, depending on the activity we're doing. Our healthcare workers in the system who treat COVID patients every day, as well as screening literally hundreds of symptomatic patients in our influenza-like illness clinics, have done this very successfully with very, very few infections. In fact, I think we've had probably 400 healthcare workers out of 17,000 who have been infected. Well over 90% of those have been in the community. Those on site, typically when we investigate, have often been from another coworker who became infected in the community. We probably have had early in the epidemic some infections where we did not know specifically of an infection in a patient, but it has been very, very rare. And we are finding that this is a very, very safe and effective method if PPE is followed and you do this. Our epidemiologists have really studied this extremely well, that face shields do have some advantages over face masks and vice versa. Together, they are extremely effective, but each individually is also very effective from a number of studies that we've looked at. So, I personally, and I'm no spring chicken here, and at risk, like many of our older faculty, for example. And we have physicians, well over 65 and 70, including myself, who are here every day seeing patients and feel comfortable and safe about that. Clearly, teaching is extremely important for our students, and I personally think in-person is better than online, but obviously where we can do online, we will. But there are clearly areas where I think it is extremely advantageous for in-person learning, which I think can be very effective in certain circumstances and needed in certain circumstances as well. The other thing to mention, not only do I personally feel very safe, but we have at the University of Iowa some of the best track record in terms of treating COVID infection. Every single patient that needs to be hospitalized has access to convalescent plasma or remdesivir, dexamethasone. We also have a home treatment team that when they follow high-risk vulnerable patients who are diagnosed with COVID, if they follow them from initial diagnosis, the outcome is excellent. They have followed now 640 such patients. Only one has died of 640 high-risk patients. That's a 99.84% survival rate. So I think we are really fortunate to have such experienced and experts here at the University of Iowa who are accessible for everyone here at the university, and really do encourage everyone to use their PPE. But if you do become infected, you can be assured you will receive superb care. Obviously, we don't want anybody infected at this point. We are working very hard on some vaccine trials and we are leading in that area, and hopefully we will have one by the end of the year that may be available. Again, in the meantime, do the smart things, stay safe. Obviously, if you're especially vulnerable, older, really try to minimize your contact with others. And when you do need to work with people, wear your PPE. If you wear your PPE, I truly believe you will be safe.